Dr Simi is a luxury health, wellness and leadership brand pioneered by me, Dr Simi Alabi. I have a clinical and leadership career spanning over 20 years, and this enables me to bring you actionable information, products and services to enable you live your lives to the fullest. My career in health has seen me work across various specialties, from children's health to urgent care to family medicine. I have a keen interest in women's health. My career in leadership has seen me work across organizations and deliver results from time to time. The whole aim is to help you live your lives to the fullest, as I said, and I want you to make sure you come back to our channel if you're ready to take action right now, to come back to this channel over and over again, and make sure that you invite your friends to connect with us on social media as well. I've had a long career in medicine, but I know that it is not the doctor that heals. I know that it's a combination of every aspect of your life, and usually even a higher power involved as well. So I want you coming back and learning more from us and making sure that you come into our offices, and we can even come to you as well to make sure that you live that life to the fullest. In this new era, and with the COVID pandemic, no one else is responsible for your health apart from you. So there are 5 equipments that you should have at home to make sure that you're always at your best and optimum health. The first thing you should have is a blood pressure monitor. You know that so many Africans particularly die of high blood pressure. They suddenly have a stroke or suddenly have a cardiac arrest. That's what we call a heart attack. And usually people will say, we don't know what happened. Many times, their blood pressure is very high and they're not even aware at all because they have no symptoms. So take notes, go and buy yourself a blood pressure monitor. They are not expensive. You can order them online and know what your blood pressure is, and also know what a normal blood pressure is. A normal blood pressure should be reading 120/80 or below, nothing more. So the first equipment you should have is a blood pressure monitor. The second equipment you should have is a SATS monitor. It's a small little equipment that you put on the tip of your finger, and it tells you how much oxygen you are getting. It is a lifesaver because you know that if it's below a certain level, then you need to be going to the hospital or calling for help. And if it is higher than that, then you don't need to worry. It's not just because of COVID. For people who are asthmatic, it's a very big life-saving equipment because they know that if their oxygen levels go below a certain point, then there is crisis. So that is your second equipment. So the third equipment you should have is your blood sugar monitor. This is very important. Diabetes is also a silent killer, and many people are walking around with diabetes and are unaware, many times only finding out when they now have kidney failure or other types of severe disease. The blood sugar monitor is cheap, it's easy to use, and you can actually share it across more than one household as far as you're keeping the needles clean, making sure you're not reusing needles, and making sure that you're keeping the equipment safe. It will tell you what your blood sugar level is, and you know that if your blood sugar level is high, then you need to be speaking to your healthcare provider. Many times, a simple lifestyle change will make your blood sugar better, or medication. It's very easy to look after diabetes if you catch it early. So buy that blood sugar monitor. Number 4 equipment is your first aid kit. Now, when you have a little injury at home or something happens at home, you should be able to bring out your first aid kit and dress the wound. You should be able to perform little operations at home without having to go in. If you have a needle stuck in your foot or in your leg or in your hand or your children as well, the first aid kit is crucial. And then lastly, this one is very interesting. When people are in pain or they have a fever and they talk to a nurse or a doctor and they ask you, have you taken anything for it? People will say, no, I haven't. You should have, because you should have a little box at home that has these emergency medicines. And what emergency medicines should you have in this box? Painkillers. So paracetamol is an essential that should go in there. Antihistamines. What are antihistamines? They are for allergies. So if you get a rash or you get something bite you and you start reacting to it. So simple antihistamines. You should have things that can help you have more water in your body if you have something like gastroenteritis where you're going to the toilet, you've eaten something bad, you should have something that will help rehydrate you. And little creams and potions to help you with, spots on your body. Just simple emergency medication at home. These 5 things will help you take care of yourself. Healthcare and wellness is no longer the way it was before. Things have changed. Now you are in the driving seat of your own health. If you want more information, or if you want to know where to get all this equipment, if you connect with us, we'll be able to connect you to the right suppliers and be able to supply you with this equipment should you need them. I hope you've learned something, and I hope you go out and buy this 5. Thank you so much for joining me on today's episode of Dr. Simi. Now, we will be back again next time. Remember to subscribe to our channel and to connect with us on all our social media handles. We are at Dr. Simi on every platform. Check out our website. It is www.dr-simi.com, and join us next time on the next episode of Dr. Simi. And today we're going to be talking about wellness. So welcome to the world of wellness. That term wellness confuses people quite a lot, but there should be no reason for confusion. Wellness just means that you are seeking to make sure that you are in mental, physical, and spiritual balance, that your health is in your hands, and that you are making sure that every aspect of your life you are paying attention to. You are your own first doctor. So no doctor can tell you about yourself more than yourself. We as doctors are only here to help you answer those questions that you may have and to give you the investigations and the diagnosis that you may need. But really, you are the one in charge of your wellness. And there are different dimensions of wellness. Wellness is a very dynamic process, so it never stops. There is no end point, there is no destination. And as I said, different dimensions to it. Again, I want you to listen and to take notes and to try and follow these steps. The first dimension is usually your daily habits. Your daily habits are very important and they contribute to your eventual overall outcome. So there are things that you should do in the morning. First, you have to wake up well. So it means you have to have slept well. And sleep is a very, very, very important aspect of our wellness, and it's a whole other topic. So if you're suffering with issues with your sleep, connect with us and we can work with you through that. And there are other things you should do when you wake up in the morning. Your water, hydrating yourself. So drinking water is important. Meditation, so connecting spiritually with your higher self is so, so important as well. And do not forget to journal. I think journal is one of those things that we underestimate the power of. It's like confession, it's like affirmation, but writing it down, writing down your thoughts, writing down what you're grateful for, and writing down your hopes are so important. And as you know, Dr. Simi has a special journal just crafted for you. So if you want to try one of our journals, please order it via our link. There's so much you can do on a daily basis, and I mustn't forget exercise. Exercise has been proven to lift your mood. If you are suffering from depression, it actually helps to treat mild to moderate depression. So exercise must not be underemphasized. You also know that exercise prevents disease. Everybody knows that. So that's the first dimension, your daily habits. There are other things you should do during the day. There's so many other things. So reading is also important, expanding your knowledge. So the second dimension is your physical checks. Physical checks are not things that you do daily. You do them 6 monthly to yearly. And that's when you check your weight, you do your blood tests. You make sure that you don't have diabetes, or you go and see your doctor. You do your routine scans, you check your breast. Breast checks, for instance, should be every month anyway. Any woman should tell you that. And it's not only women that should check their breasts. Men should also check their breasts, because men can also get cancer of the breast. And people are not aware of this. So that the physical checks are very, very, very important. You must do them. And again, as I said, that's about every 6 months, every 12 months to get that done. And for that, in different parts of the world, it varies. But make sure that you do yours at the right time. The third one is a very important topic for me and is actually very close to my heart, which is your mental health. I see mental health as the concrete underneath everyone. How healthy your mental health is determines your outlook in life, how you behave, how you treat people. If you're mentally healthy, everything around you works. Check out if you're stressed. Are you stressed by anything or anyone? Check out if you're suffering from depression. It's easy to find out if you're suffering from depression. There are simple questionnaires that you can do that will give you an indication as to whether you're depressed. What about anxiety? Some people are so anxious. We have patients that are anxious about so much. They have so many worries, so many concerns, and they can't control it. Some are even worried about going outside. They are worried about mixing with people. What about the COVID pandemic? We have patients who cannot even go out for fear of catching COVID. So anxiety, again, is a real thing. So mental health is so important. And our journal also is a mental health journal. So be sure to connect with that journal and buy it and use it for your mental health too. So mental health is important. And let me know how you are doing with that. Now, what's number 4? Number 4 dimension of wellness is your relationships. Relationships are interesting. What is your relationship with your friends, with your family, with your children, with your workplace people? Some people are suffering with bullying at work, for instance, and that affects everything in their lives. So making sure you curate your relationships and make sure that the people around you are helping you to grow. One of my favorite sayings is that if a relationship is not helping you grow, it's not making you better, you're not making each other better, then that relationship really must be redefined because it's not good for your overall wellness. And number 5, building your passion, your career, your business. Life is about achieving the Maslow's law of hierarchy, where you want to get to that pinnacle where you self-actualize. So if you have a career, you have a business, you have a passion that you follow, it is so important that you build that and you spend time nurturing that so that you can be well. It's part of your wellness. You find that if you're not pursuing your goals, if you're not pursuing your career or your business or not being supported to do it, you don't feel like you are very, very, very well. So it's really important that that number 5 is checked as well. So those are our 5 dimensions of wellness. I hope you can remember all 5 of them. Don't forget your daily habits, your physical checks, your mental health, the relationships around you, and making sure that you build and follow that passion of yours. So if you've enjoyed today, make sure you share the video. Make sure you connect with us on all our social media handles, and we'll be excited again to connect with you at the next episode. If you need any help with any of these 5 things, remember that we don't only provide information, we also provide services. You can come and see us and we can come and see you. There's different packages for everyone. So remember to connect with us. Today we're going to talk about mental health, and in particular depression and anxiety. I'm really pleased that these topics have become easier to talk about in the last year. I think before that there was a massive stigma attached to mental health, particularly in the Black community. We have to be able to talk about these things and to be able to identify and provide support and treatment early on. So did you know that depression was one of the most common illnesses globally? And did you also know that Black people suffer from depression and anxiety more than their white counterparts? It's difficult to believe because we don't talk about it, because we smile and we believe that we are cured of it. So what are the symptoms to look out for? Again, it's not just a day's sadness. It has to be persistent sadness lasting at least 2 weeks. And also the inability to take pleasure from anything in life. Things that you used to enjoy and you wake up and you can't even think of facing them. Those are indicators of depression. Of course, there are many other symptoms. So disrupted sleep, not eating very well or overeating, when people say they are stress eating, can be a sign of depression. Not wanting to be alive, self-harming, various reasons, unable to concentrate, unable to remember anything, so forgetfulness, and just thinking of committing suicide. Suicide is particularly common in men. So men don't exhibit depression the same way as women do. So it's important to recognize the differences. Anxiety can also be mixed into the picture. So where you're worrying, maybe you're worrying about your finances, you're worrying about your children, you're worrying about everything, things you have no control over. You're also very irritable, so you get annoyed very easily. You might be having palpitations, just unable to relax, unable to settle down. If you have any of these symptoms or you see this in other people, it's important that you seek help. Now, what should you do if you suspect that this is the case? Talk about it. I think it's so important to have supportive friends, not people that will look at you and think, oh, maybe you are not really serving God and that's why you have depression and anxiety, because that's not the case. Even people who are spiritual suffer from mental health problems. So talk to somebody, find a friend. Remember that, as I said before in another episode, so look for that episode, that exercise is a treatment for mild to moderate depression. So that's when you need to put in an exercise routine, put it in your diary, schedule it. Speak to your doctor. Sometimes you might need to have some counseling, a professional counselor, not just someone who thinks they know. And medication sometimes is a last resort and is useful and is effective. There's nothing wrong with taking medication for mental health problems. You will take medication for a headache, so there's nothing wrong with this. There's so many other things to discuss, but we're going to keep it short today. So what I would like you to do is, if you think you're suffering from any of these symptoms, that you sign up for a virtual consultation with us and see if we can help. Or if you have a healthcare professional or provider that you use, that you go and meet them and find some help today, because that can unlock and make your future much, much better. I hope you've enjoyed this episode. I know it's not as cheerful as usual, but it's a very important one. If you've enjoyed this episode, please share it with your friends and your family. Connect with us on all our social media handles at Dr Simi on Facebook, Instagram, Twitter. Join the community, share your experience, share your solutions that you might have. Also, if you need help, go to our website, www.dr-simi.com. Sign up for a virtual consultation. Diagnosis can be made virtually and you can get help that way. I look forward to seeing you on the next episode. In today's episode, we're going to be talking about concierge health. I'm not sure if you've heard that before or if you know what that means. Concierge just means that we are taking charge of all your health needs so that you don't have to worry. This service is particularly useful for the busy executive, for those who don't have the time to really think about their health services that much. We will take control of that. As a patient, you have some certain rights. You have a right to ask questions. So we will give you a service where you can ask us any questions and challenge us. And for us, what we do in our concierge service is to take charge of everything for you so that you don't have to worry. Particularly if you're a very busy professional or someone that is running a very, very stressful business. What we do is that we take charge of everything. You have your standard checks twice a year to make sure that there's nothing lurking that you don't know about. And this offer is also available for the rest of your family. So we not only provide concierge health for the individual, the busy executive, we also provide this concierge service for the rest of your family as well. So what else do you have to look forward to? So we will send you out newsletters, we send you health information, and then you also have access to a team. So if you were unwell, for instance, you can get a certain number of consultations as part of your package. Usually your consultations will be virtual. We believe that as busy professionals, you wouldn't want to come in unless it's absolutely necessary. And with the way the world has advanced, most of healthcare now is delivered virtually using digital means. So it will either be a telephone call, a video consultation via a secure platform, or via email or even text. But we make sure that you have access to your consultations this way. With Concierge with Dr. Simi, we also offer travel concierge. So sometimes some of our clients might have illnesses that they need to go to another hospital for, or they need to travel out of the country for because they cannot find a specialist locally. We will provide the right healthcare team to accompany you on the journey and to make sure that you get all the services that you need. So you always have like a guardian angel watching over you. This is a wonderful package. I think this is a package that I would want for myself as well, where I don't have to worry about my checks. I don't have to remember when to do what. It is really an attractive one. So I'll suggest to you that if you do think that this resonates with you or is something that you would want to explore, that you connect with us. I think the first place for you to go will be our website to fill the form or to book a consultation. And our website is www.dr-simi.com. You can also connect with us on all our social media platforms, which is at Dr. Simi for Instagram, Facebook, and also Twitter. Send us a DM, send us a comment, encourage us. We would love to hear from you. And take care and see you next time. In today's episode, we're going to talk about leadership. Leadership is one of those areas that I stumbled into many years ago. And one of the questions I generally ask is, are leaders born or are they made? Well, growing up, I had no interest at all in leading anything or anybody. I went to boarding school and I kept a very low profile, tried not to be noticed by anyone. That being said, I was 2 years younger than the rest of my class, so really it was more important for me to stay safe than to try to be anybody's leader. It didn't even cross my mind. But as I got older and got into university, I was still very low-key, just focusing on studying medicine, not interested in leading anybody. But a switch happened after I became a doctor and I moved away. I realized that if I wanted to have a change and I wanted an impact or an influence into my own future, I needed to get involved. So I took action and I started representing my colleagues, and then from there it grew and it snowballed to the point where most of my work became leadership and less of the time I was practicing medicine. And then I eventually got to the highest level of leadership where I was, and I realized that there was a formula to getting to this point, particularly when you're in an environment where the chances of you getting to very senior leadership is very, very, very slim. I'm very passionate about helping people who are in mid-level leadership or mid-level management who are really interested in pushing upwards and going up to board level. I'm really keen to help you to do that. Because you're a practicing doctor or nurse or artist, you can get into the leadership of your sector, and the strategy is really the same. The principles of leadership start first with what we call self-leadership. And self-leadership comprises of self-regulation, self-awareness, and self-motivation. There are various other levels and other parts to leadership, but I want you to come and join me and sign up for your strategy sessions. If you are interested in leadership, it's not for everyone, although I say that by leading, you are already leading. If you're not leading anybody, you're leading yourself. But if you want to move up in your career and you want to get into the senior level management and leadership, and you want to become a board level executive, then this course is for you. So I hope you've enjoyed listening to a bit of my story today, just sharing about my own leadership journey. Anyone can be a leader if you choose to. Please connect with us on all our social media platforms at Dr. Simi on Facebook, Instagram, and Twitter. Join our community, leave your comments. And better still, check out our website. It's www.dr-simi.com. Sign up for the leadership course. No one is born a leader. We are all made leaders. So if you're really determined, you can do this. I look forward to seeing you on the next episode. On today's episode, we're going to be talking about why you're not losing weight. Talking about weight gain is quite a difficult subject for many people. And in my career, I found it very challenging to talk to patients about this. And what we don't understand sometimes is that people are trying their very best and are just not able to lose weight. So there are some questions again that I want us to go through today to help you think and to help you consider whether your lack of ability to lose weight is due to something outside your control, and whether if you tackle those things, then you will start to see that the scale shifts left. So it's important that we talk about that today. Now, do you know what is healthy or unhealthy weight? Your BMI is a number that you should know. So if you don't know what BMI means, again, send us a message and we can help you calculate that. It's just your weight divided by your height squared, and it gives you a number. And that number should be below 25. Between 18 and 25 is the normal BMI. Now, if that's over that and you're finding out that you are bigger than you want to be, you're struggling to keep up with your children, you can't run around, you can't exercise properly without being out of breath, you can't climb the stairs, maybe it's a sign that you should try and lose weight, but then you might be struggling. So what are some of the reasons why you may be struggling? Number one, you may have a disease that is not allowing you to lose weight. For example, a poor thyroid function, what we call hypothyroidism. You find that people are big and they do everything they can to lose weight and they just can't. And many times they don't know that they are hypothyroid. And a simple blood test will tell you about this, and simple medication will help you control this and you'll be able to lose weight. So check your thyroid function. There are other diseases that can cause weight gain as well, including diabetes. There's a few of them. That's why it's important for you to have that idea of wellness, checking yourself, knowing whether there's a problem or not a problem. So that's the first reason. There's another reason why you may not be losing weight. Could it be linked to a medication that you're taking? Sometimes you're taking some supplements or some medicines which make you put weight on. There are several examples of that. But a quick one is medication that you might use for your mental health. It may cause you to get bigger than you want and struggle to lose weight. So it's important that you check that. Now, what's number three? Sometimes we think we're eating healthily and we're not. That's the biggest problem. Because you're not looking at the food you're eating. You think it's healthy, but it's not. For even drinks, you might think that there's a healthy drink, but if you look at the ingredients in that drink, there's lots of sugar, and sugar will help you put weight on. So check what you're eating. It is very important. If you're not clear on what the right food to eat or the right drinks to have, you can contact a nutritionist or you can get in touch with us and we can look at a plan together. It's very important for you to do this. Now, what's the number 4 reason why you might not be losing weight? You may be exercising, but what if you're doing the wrong exercise? You can do exercise and put on weight, right? So for instance, if you're focusing a lot on weights, so on resistance exercises, which build muscle, you might find that you are increasing in weight rather than losing weight. So with exercise, again, it's important to have a mix. Having exercise that raises your heart rate a lot, what we call cardio, in combination with weights, the resistance, so that you can also tone up. So it's important to look at your exercises. And people underestimate the importance of talking to somebody about an exercise plan. It is very important. And then what's the number 5 reason why you are not losing weight? I am telling you this one, particularly in some parts of Africa, it's your job. Your job is the biggest reason why you're not losing weight. Do you know why? You sit in traffic all day, you sit in your car all day, you get to the office, you sit down all day, you sit back in your car to go home, you go to bed, you can't lose weight with a sedentary lifestyle, even if you have done a bit of exercise. So we say that having a sedentary lifestyle is almost like the new form of cancer because it causes disease. You have to be moving. You have to be moving. Movement is so essential. So those are the 5 reasons why you might not be losing weight. Do you identify with any of these? Then if you do and you want to talk more about it, connect with us on our social media platforms. Follow us on Instagram, on Facebook, join our community. Let's discuss this. Let's offer you some support. Again, you can also see people in our team as well to help you. We really want to help you live your best life. So we look forward to hearing from you. And we also look forward to connecting with you on the next episode. And don't forget to check our website, www.dr-simi.com. In today's episode, we're going to talk about an interesting topic. And I'm going to put it like this. Does black skin crack? Now, people always talk about how black people don't age. We don't really look old. Everybody looks young. And we don't age as quickly as our Caucasian counterparts. Well, I think black skin cracks, particularly if you know what you're looking for. So aging is something that we're all going to go through. From the minute you're born, you're aging till you die. So that's going to happen whether you like it or not. There are some habits that you would indulge in that will speed up your aging process quicker than you imagine. However, if you smoke, drink alcohol, eat the wrong foods, do not exercise, those will speed up the aging process. So if you're smoking, alcohol, a lack of exercise, being exposed to a lot of sun without any protection, all of that will age you. Eating the wrong food. So nutrition is also very important. Not taking the right supplements. All of those things will make your skin crack. So the first step is making sure you get all of that right. But if you're doing all of that, and particularly if you lose weight suddenly, that might age you severely. There are other things you can do. The biggest way to identify age is the nasolabial folds, this line down from your nose to your mouth. It really shows the age, and that is when you've lost facial fat. And that can happen as you get older or if you lose a significant amount of weight. You can work to improve that. People do various things, they use creams and face exercise, but really there are other easier procedures that work. Have you ever considered something like Botox or dermal fillers? And many people don't discuss it. And it's interesting that in the black community is something that we don't share. So you see people who have visibly had Botox and have had fillers, but will never discuss it. But again, you don't have to discuss it with anyone, but it's a simple procedure, doesn't have any downtime. You can pretty much go in your lunch break from work, go and have Botox, have some filler, look years younger, and nobody would know, and you can go straight back to work. So is it worth doing? Is this something you've considered or thought about? Well, if you think your skin hasn't cracked, why don't you send us a picture and tell us your age? If you think you look really much younger than you are, let's do a challenge. Please connect with us on all our social media platforms. Give us your comments. Are you for these aesthetic procedures? There are other procedures as well that I may not have mentioned that help to slow down the signs of aging, like chemical peels and the rest of it. Check out our website, www.dr-simi.com. Book a virtual consultation or even book to come in and have your Botox or filler done. In today's episode, we're going to be talking about an interesting topic. I've titled it 50 Shades of Black. That's because we are black, but we have different shades. We're really talking about skin lightening. This is almost a taboo subject, and that is why I'm talking about it. Because we need to bring this out into the open. We need to discuss it and stop shaming people who choose to lighten their skin. They've been made to feel that they're not proud to be black, but actually that's not the case. There are many reasons why people choose to lighten their skin. It may be because they want an overall brighter look. It might be because they have some scarring on their face, on their bodies from acne. There has been so much debate about this, and I feel that this is time that the medical world actually comes out and talks to patients and talks to people who decide that this is what they want to do. Whatever their reason is, they deserve to have a safe way to lighten their skin. Well, I must warn you that there are very unsafe ways to lighten the skin. One of the products that you really should not use without advice from a qualified dermatologist is hydroquinone, because it can damage the skin and cause other side effects as well. I think black is beautiful. I know that black is beautiful. However, sometimes there may be a need to lighten your skin. It may be because you have a lot of scarring from acne. It may just be because you've had some treatment and your skin has gone darker. For people who have eczema and they have thickening of their skin and it's dark, then it's worth having the opportunity and having that ability to lighten your skin if you choose to. Now, what are the safe ways to lighten your skin? There are products out there that help. For instance, any product that has kojic acid will help to lighten the skin. Alpha hydroxy acids are also good. And then we have the almighty glutathione. Glutathione is not for lightening the skin. It's actually just a side effect of glutathione, that your skin gets lighter. It's called the guardian of the cell, the master antioxidant. I will be talking about glutathione in another episode because it's such an amazing supplement. It's produced naturally in the body, and when you have extra of glutathione, it's quite amazing. Of course, you have to do this safely because you can have too much if you're not careful. So glutathione is a safe way, particularly in combination with vitamin C. Intravenously can help give you that overall brighter, more vibrant look, which you may need, particularly as you get older when the skin gets a bit duller. I would really want to hear your views on this. I know this topic is quite divisive and actually controversial, but it's worth discussing it. It's useful to know that you can lighten your skin if you have to. It's useful because then you have the opportunity to get rid of scarring or get rid of any patchy areas of your body, and it gives you that overall brighter look. I mean, glutathione in combination with vitamin C is wonderful for making you look brighter. You know, lightening your skin doesn't mean that you're not proud of being black. It just means that you want to get rid of patches that you don't like. After all, I would say people from the other continent darken their skin because having darker skin makes them feel more vibrant and healthier. So I would like you to suspend your judgment, really think about this, and send us some comments as to what you think about skin lightening. In another episode, I'll be talking a bit more about glutathione. Glutathione, the main use of it is not to lighten your skin. It is an antioxidant. But join me on another episode where we'll be delving into this guardian of the cell, as we call it. In this episode, we're going to be talking about one of my favorite antioxidants. This is called glutathione. You should check out our previous episode where we mentioned the effects of glutathione on the skin. Glutathione is what we call the guardian of the cell. It looks after your cells. It is a master antioxidant. Antioxidant just means that it prevents you from being damaged by free radicals in the environment, toxic chemicals in the environment. It's an amazing antioxidant. It does so much. Glutathione we deliver intravenously, although it's available in tablet form and also suppository as well, which is more useful for maintenance. Glutathione decreases the effects of stress on your body. It improves your sleep. It improves your joints. It slows down the aging process. It improves your performance in every way. It improves your skin, your hair, your nails. What is not to love about glutathione? I must mention to you that It is produced naturally in your cells, although the amount decreases as you get older. So it's useful to have glutathione regularly. We deliver it about 600 milligrams to 2,400 milligrams per session. And to show you what it looks like, it comes in a little vial like this, and it's in a powder form, which we dilute and then we give it to you intravenously. So it is quite easy to deliver, and I particularly enjoy giving this to my clients with vitamin C, not together, but in the same session. So this is a 600 milligram vial, and again, you can have up to 4 of this per session, and usually over the course of 6 weeks. The effects are startling. Your hair gets better, your skin gets better, you sleep better, and then eventually it reverses the signs of aging. So if you want to slow down the aging process and have your luminous bright skin, then you want to be using glutathione. Again, none of the things we're discussing here are medication or treatment. They are more to help you live your lives to the fullest. So if you're looking for that lushness in your hair, your skin, your nails, then it may be worth considering glutathione. As I said before, the side effect of having glutathione is that your skin may be visibly lighter, more than a shade lighter. So if you are one of those people who is considering skin lightening, then it's worth trying this. We discussed skin lightening in a previous episode, so you can go back and watch that before you make your decision. So if you've enjoyed today's episode, please connect with us via our website. Go ahead and book a consultation, or even just try some glutathione. Usually we do that with vitamin C. So book a consultation, have your glutathione, see what you think. In this week's episode, we will be talking about intravenous vitamins, or shall I say intravenous supplements. Now, we've talked about you taking your vitamins and your supplements orally, but there are some times when it's not suitable for you and you believe that you should have it directly into your system. Intravenous supplements just means that it goes through your veins, usually through your hand, just in there, with a very small needle, and we give you a dose of supplements that helps to supercharge your wellness. It is very safe, and the advantages are quite a lot. So you get a large dose, larger than you would ever get if you took it orally. It also doesn't go through the stomach, so you get the actual supplements direct to your system. You see and you feel the effect almost immediately. And at Dr Simi, we provide this as a mobile service, or you can come in and have this delivered to you. We have a long list of different packages, different intravenous supplements available for different aspects. So we have some supplements for energy levels, just to boost your energy levels. We have some intravenous supplements to help your hair. These are not medication, these are not medicines, but they help to improve your outcome. So we have supplements that help your skin, for instance. As you know, or you may not know, that vitamin C in substantial amounts will allow you glow. It will make your skin glow very well. And also things like glutathione. You should have heard about glutathione. We also call this the master antioxidant because it prevents free radicals, which are the toxic elements in the environment, from damaging your skin, and it slows down the aging process. There are so many others. We have amino acids. We have them already pre-packed most of the time, and there are some that we make up specially for you. We've had fantastic client reviews of our intravenous nutrition, what we call them intravenous micronutrient nutrition, IVNT, but you can just call them the IV drips. Perhaps the most popular one is the Myers cocktail, or the modified Myers cocktail. You should have heard about this. Intravenous supplementation started way back in the 1960s, and it has gathered a lot of popularity. So it's worth a try. It's wonderful. It's very, very good for you. It is safe. You get a large amount of the supplements that you need direct into your bloodstream. It doesn't give you side effects. It doesn't go through your stomach. And we just love it. And our clients absolutely enjoy having this done. The most popular one you may have heard of is the modified Myers cocktail. And this was developed way back in the 1960s and seen to have advantages. They are not medication, they are not medicines, they are not for diseases. They are more to boost your energy levels and to boost what you have already. We have a full menu. We have quite a lot of them, which you can have a full list and look at the full list on our website. You have different packages. There are some that help to boost your hair, boost your skin, boost your gym performance, just give you that overall energy. And there's even a fantastic one for weight loss as well. So if you're struggling to lose weight, you can have one that is the fat burner that helps you to lose weight quicker. So if you want a full list of the menu that is available, go to our website and we'll have a full list there with the price list as well, and see if this is something that you want to try. I'm sure that if you try it once, you probably won't be able to stop having it. So if you've enjoyed this episode, make sure you come back and watch again. If you want to know a bit more, just follow us on all our social media handles. As I said, check out our website, book a free consultation. So the price of the consultation is offset against the service that you purchase. So just book a consultation, just try it, see how you feel about it, and hopefully you will be very happy. In today's episode, I'll be posing a question to you, and I would like to hear your comments. Should healthcare be digital? Should the majority of healthcare delivery move over to a digital platform rather than you going in physically to see your doctor or your nurse? As the pandemic started, what happened was everybody moved over from going in to see doctors to actually telephoning their doctors, seeing it on video or email or text. Everything changed in the most developed economies. Of course, in the lesser developed economies, there was a bit of a struggle because we didn't have the infrastructure to support it. But it's a lesson learned and a preparation for the next time a pandemic comes around. The truth is, most health problems can be sorted out virtually. We don't generally allow people who do not need to be in a hospital or any healthcare setting to come in unless it's absolutely necessary. It was very important for us to do this, but also important to see what your opinion is. Many places in Africa could not do this because we didn't have the infrastructure to set this up. So what's your opinion? How have you found it so far? I would vote for virtual health. The same way other industries have advanced, banking has advanced over the years, where you do all your operations online unless you have to go into the bank. That's the same way healthcare should evolve. In the past, people would come in with viral illnesses and then get the nurse and the doctor ill, and they had to take time off work because they were sick for an illness that had no cure, and the body normally will cure it by itself. Of course, there are always exceptions to the rule. There are some illnesses that you have that you really must seek help immediately. For example, if you suddenly develop a chest pain, which can be a sign of a cardiac arrest or a myocardial infarction, as we call it, which is a heart attack, you should not be waiting around calling your doctor. You should be calling for an ambulance or calling for help. If you have difficulty breathing, or if it's a child who's under 5, or if there's severe bleeding, those are emergencies and you do not need to wait to have digital healthcare for that. It's really a lot of common sense. If you know you're feeling extremely unwell, then you should seek help. But at other times, to be honest with you, I think digital health is the way of the future. Many industries have advanced over the last few years, and I think this was the leap that healthcare needed. The healthcare systems had been trying to do this for many years, and the adoption of this has been slow, but the pandemic moved this forward in a huge way, and we're very excited about that. It has also exploded different industries, and it has increased business for the people who are digital geeks. So in my view, I think this should be something that we pursue, but I would really like to hear from you, because a system is only as good as what the patients think, what your experience is. It would be good to hear what your views are. So if you've enjoyed this more technical topic, please connect with us and post your comments in the comment section. Let us know what you think. Let us know what your experiences are. Connect with us on all our social media platforms. We are at Dr Simi on Facebook, Instagram, Twitter, and just connect. Send us a message. Tell us what you think. And better still, book a virtual consultation with us at www.dr-simi.com. We've brought you 11 short videos over the last 4 months. I hope you've enjoyed every single one of them. If you haven't followed us yet, please go and follow us on YouTube, like, share, and subscribe. In the last 4 months, we've talked about various things in our very short videos. First thing we talked about was the 5 must-haves for your health. The things that you need to have at home to help you access great healthcare and to keep you living your lives to the fullest. In episode 6, we talked about weight loss, because we all know how difficult weight loss can be. We know it's challenging, and there may be reasons why you're not losing weight. If you haven't seen that yet, please check it out as well. And if you're still struggling, remember to book a consultation with us to help you through it all. We also explored the 5 dimensions of wellness. These are the 5 dimensions I came up with, and they are so important. Please go back and look at that video. They include things like your daily habits, where we talk about journaling, drinking water, meditation. We talked about your health checks, which you should have regularly. We talked about the people you surrounded yourselves with, and then your mental health. And finally, we really explored how you build your passion, because we know that it's important that you pursue your passion for you to feel well in yourself. Mental health also took a center stage in our videos, and we went deeply into depression and anxiety, understanding the difference between the two and knowing when it is that you have to seek help. Dr. Simi also provides tailored, personalized concierge healthcare for select clients. This helps you actually tailor your consultations to your own convenience, and we also carry out referrals to the best specialists at the best rates as well. We accept certain insurances, including Aviva and Aetna Global Insurance, so feel free to inquire with us. We also delved into leadership, because we believe that everybody is in leadership, whether it's leadership of yourself, which I really like that topic, self-leadership, or in your family or at work. Whether you like it or not, you are involved in leadership. So it's important that you learn all you can about leadership and how to be the best leader that you can be for yourself and for your community at large. Please do get involved. It is important. So the skincare series started in episode 7, and we really focused on skincare because that goes through to episode 10. We talk about positive aging as we get older, particularly women. It's okay to get older, but also do it with happiness and joy, and also use whatever you can to make yourself feel better. We talked about things like Botox, dermal fillers, skin peels, everything you can do to have that youthful skin that looks really, really alive. Please check those out. We talked about things like glutathione, we talked about skin color, we also discussed intravenous micronutrient therapy. There's so much out there that you can do, so please do check us out. And finally, we talked about digital healthcare, one of my favorites. I believe that as other departments and other sectors are getting digital, healthcare should do the same. So your healthcare should be a combination of seeing your doctor or your nurse or your pharmacist, and also contacting them via digital means, your telephone, your app. There's so many things that you can do. I really hope you've enjoyed our season. It's been a wonderful time. I've had the great pleasure of bringing it to you. We want to continue to give you more interesting content, and content that will help you live your life to the fullest. Everything is related to health, to wellness, and to leadership. So if there's things that you want to talk about, or things you want me to talk about or share, please drop it in the comment section. Let me know, and we can explore this really, really, really fully. And please, if you want to come and join me and just talk about healthcare and wellness and leadership,
also do get in touch. We hope you've had a wonderful time, and thank you so much for supporting. Remember to like our channel, subscribe to the channel, let us grow with you, and also remember to share as well. Have a great day, have a great week, and have a great life.